Welcome to the deep dive. Today we're looking into a pretty major shift happening in healthcare. It's called value-based healthcare, or VBHC.
Mhm.
We've gone through a recent, pretty comprehensive concept analysis on it.
Yeah, it's quite detailed.
And our goal here is simple, really. We want to equip you with a clear understanding of what VBHC actually is, its core parts, and I guess why it's such a critical movement for all of us.
Absolutely. And what's really key, I think, is that VBHC tries to do two big things at once.
Yeah.
Improve the quality of care quite significantly and bring down costs. But crucially, doing all that while focusing on the outcomes that matter most to you, the patient.
Right, from the patient's point of view. So let's unpack that a bit. How do the sources define VBHC at its core? What are we really talking about?
Well, the research describes it as a structured approach. It's for healthcare systems to get better at both quality and efficiency.
Quality and efficiency.
Yeah. And they define value pretty clearly as health outcomes achieved per unit of costs. Or maybe simpler, outcomes that matter to patients divided by cost.
Outcomes over cost. Got it.
And this lines up perfectly with that concept called the triple aim. Improving health outcomes, making the patient experience better, and importantly, reducing the cost side.
Okay, so value is the main idea. What are the building blocks? The analysis mentions sort of foundational elements, right? Pillars.
That's right. The analysis identifies three key defining attributes, or pillars, as you said. First up is the monetary value of health service.
Okay, monetary value. So just cutting costs.
Not exactly. It's more nuanced. It's about finding that sweet spot, achieving a balance between cost efficiency and patient outcomes, making optimal investments rather than just slashing budgets.
Optimal investments.
Well, think about ensuring treatments are genuinely cost-effective. So they lead to faster recovery, maybe help you preserve your productivity, get back to work sooner, that kind of thing.
Ah, okay. And this links to that sweet spot theory mentioned in the reading, right?
Right.
Where more isn't always better.
Exactly. That theory is fascinating. It shows there's an ideal point, like with nurse staffing, for example. Investing more beyond that point doesn't necessarily improve outcomes, and sometimes it might even be, well, counterproductive. It really challenges that simple more is better thinking.
So it forces a more strategic look at resources. Makes sense. What's pillar number 2?
Pillar 2 is quality of care. This covers a lot of things like how easy it is to access care, how effective the treatments are,
Right.
and critically, your experience and satisfaction as the patient. It's really about making sure the care you get meets, or hopefully even beats, your expectations.
Okay.
And the third is patient-centered care, or PCC.
PCC, right.
Yeah. This really puts the focus on actively involving you, the patient, in your own healthcare decisions.
So my preferences matter.
Absolutely. Incorporating your preferences, your beliefs, your values into how care is delivered. And these three things, monetary value, quality, PCC, they aren't separate. They work together.
Like gears meshing?
Precisely. They reinforce each other, boosting financial efficiency, improving clinical results, and making the whole patient experience better.
Okay, to make this less abstract, the analysis gives a model case, doesn't it, Alex?
Yes, Alex. A 45-year-old teacher diagnosed with type 2 diabetes. He went into a VBHC program.
And what did that look like for him?
Well, his care was multidisciplinary. They used digital monitoring tools, a smart glucometer, a mobile app, things like that. So they could make adjustments remotely, which, saved costs and saved Alex time. Fewer trips to the clinic.
And how did the quality and patient-centered parts play out for Alex?
Well, his care followed evidence-based guidelines very closely. Communication was smooth, thanks to a central digital record. And really importantly, they used patient-reported outcome measures, PROMs.
CROMs. So Alex could feedback directly.
Exactly. He could report on his own well-being, how he felt things were going, and that feedback actually influenced his treatment plan. He was actively involved.
And the outcome.
Significant improvements in his health. And he reported high satisfaction. It really shows the potential of VBHC.
Yeah, especially when you contrast it, like the sources do, with the contrary case, the traditional fee-for-service way.
Right, where it can be fragmented, really costly, and often focused more on just the number of services provided, not necessarily on meaningful outcomes or quality of life for the patient.
So if a system wants to move towards VBHC, what needs to be in place first? The analysis talks about antecedents, right?
Yes, key enablers. You need good healthcare data, first off, for measurement. You need supportive policies, policies that actually incentivize value, not just volume.
Like bundled payments, maybe.
Exactly. Bundled payments are a good example, where providers get paid for an entire episode of care, not every single test or procedure. And crucially, you need strong engagement from everyone, patients, providers, policymakers, all working together.
Seems like a significant undertaking. But assuming a system gets there, what are the results, the consequences?
The consequences are really the goals we talked about. Better patient outcomes, real cost reductions across the system, and higher patient satisfaction. They all feed into each other, creating a more sustainable, more efficient system overall.
So wrapping this up, what's the big takeaway for the future of healthcare?
I think VBHC really offers a practical roadmap. It's a way to get to high-quality, sustainable healthcare by genuinely putting the patient's values and needs first. It's about making smarter, data-driven decisions about budgets and funding to get the best results for patients and the system.
Which leaves us with a thought for you, our listener. How might shifting your own thinking from volume of care to value of care change how you interact with or what you expect from the healthcare system? Something to consider until our next deep dive.